Hey everybody, welcome to Author Talk. I'm Sarah Donovan, and we are meeting with the authors who contributed to the Just YA anthology, which I'm holding here as a paperback, but is available in open access at openokstate.com. So you can get it, or .org, so you can download it for free, teachers and students everywhere. And today we are joined by Sonia Patel. Sonia, so much. We're so grateful for you joining us today. Tell us where you are in the world and how you're doing.
Thank you so much for having me, Sarah. I'm joining you from Honolulu, Hawaii. Woohoo! It's beautiful weather out here. I spend my days here doing various things. Most of my time is as a psychiatrist where I work with kids, teens, adults doing individual talk therapy, and then also family psychotherapy and couples therapy as well. And then in the morning times before work, I do my writing, and I really love doing realistic young adult fiction because I think there's so much power in that type of work. So that's what I do.
Can you tell us a little bit about how you became a writer? Have you always been writing?
Absolutely, yeah. I grew up kind of writing poetry and rap, and that was really for myself and just as kind of an outlet. Um, After I became a psychiatrist, I think everyone kind of toys with the idea of writing a book someday, but it really came together for me when I kind of hit a really low point in my life, and then as a therapist, as a psychiatrist therapist, I often recommend people to use writing as a healing tool to kind of create in their minds their own timeline of things that happen and kind of getting a connection on their thoughts and feelings to those things. So I did that for myself. And that's sort of how my first book, Ronnie Patel in Full Effect, was born because that's my baby, my first baby. And I took a lot of the rap and poetry that I've sort of been working on, but kind of applied it to what I was going through as well. And it kind of made a story when I put it in a certain order. So that's how I fell into writing, was self-therapy. And I think because I'd never read anything like that growing up, I wondered, okay, if I put this together and put it out there beyond just like a personal journal, could it reach someone like me who read a lot growing up, but never read anything that got me even close to understanding what I was going through? I just thought that was my life back then. So, yeah.
Thank you so much for just giving us a little insight into how writing works for you. I think each person comes to writing in different ways. Some of the authors will say, "Oh, I've been writing ever since I was really young," and others just kind of came into naming themselves as a writer. And I love the story of thinking how writing as a way of making sense of your world, and then writing as a way of making a world for other people to see themselves in who may not have had books written for them before. So thanks for that. Love it.
Ah,
So you contributed a piece to Just YA. I wonder if maybe we should start by reading it first and then we can talk about it a little bit.
yes,
Okay.
please. I'm very excited. So, my piece is called Letter from Your New Psychiatrist. So, I will read the letter. Dear teen patient, if you are reading this letter, then your first appointment with me has been scheduled. I look forward to meeting you in person and getting to know you and your circumstances as fully as possible. I wonder, what is your suffering like? Perhaps your mood is rock bottom. Or is it irritated, irritable, worried, enraged, swinging, or shameful? Are your thoughts on overdrive, paranoid, or screaming at you that you're a worthless piece of crap? Are painful memories hijacking you without warning? Are you having sleep difficulties? Are you drinking or drugging? Are you refusing to eat or making yourself throw up? Are your grades slipping, or are you terrified of getting less than an A plus? Are you getting into fights, verbal or physical? Are you cutting yourself, wanting to disappear or kill yourself? Or maybe you are suffering in other ways. I don't know you yet, but I do know that your symptoms of suffering are not a result of psychiatric diagnoses. Did you know that those diagnoses do not actually exist? They are a construct to label clusters of symptoms. Besides offering people the first glimmer of validation of their suffering, and being utilized by health insurance companies to determine payment decisions and by schools to guide student accommodations, psychiatric diagnoses are otherwise mostly useless to suffering individuals. Let that sink in for a moment. Now imagine if after a mere 50 minutes or less of talking with you, I branded you with the psychiatric diagnoses of, let's say, major depressive disorder and generalized anxiety disorder. Not only would my ability to consider other things in your life automatically be limited, but it might be difficult for me to relate to you as a human full of complexities. I might discount things you described that did not fit your quote diagnoses and pay more attention to those things that did. You might leave my office disempowered by the false narrative of being flawed with mental disease. Let me be clear. You are not flawed with mental disease. Your genes don't code for your symptoms. While genes can predispose people to developing symptoms if environmental interplay encourages it, no single gene on its own has been proven as causative of psychiatric diagnoses. There is, however, strong scientific evidence that emotional invalidation from experiences during childhood and teenage years, even without abuse and neglect, causes damage to developing brain structures and functioning. And this damage manifests as symptoms of suffering. Your symptoms of suffering are a biological response to something external. Let that sink in for a moment. Now consider this. As one or more of a myriad of possible emotionally invalidating experiences, such as being bullied, living through family turmoil or parental conflict, being subtly or constantly gaslit, controlled or belittled by adults or peers, or being shamed or groomed by trusted adults. Damages your developing brain. Not only do symptoms of suffering appear, but healthy interpersonal attachments are thwarted. Your true thoughts and feelings remain elusive, and growing into your authentic self is impossible. So when you step into my office and take a seat on the black leather couch across from me, I won't diagnose you. Rather, you and I will begin a discussion of your symptoms of suffering and your life circumstances. Together, we will take a long, hard look at what is happening and what you are witnessing at home, at school, with your friends, and with all the relevant people and situations in your life. We will unpack how aspects of your relationships and experiences might, with or without intention, be causing you harm and emotional invalidation. Our work together will not result in you playing the victim to your experiences or blaming anyone. Instead, you will come to understand that your symptoms of suffering and negative patterns of existing in the world did not develop in a void, but as a response to the dysfunction in your surrounding system. You will begin to comprehend that since you aren't flawed, healing doesn't fall solely on your shoulders and is a process that involves both you and the system you are growing up in. Daunting as this may seem, you won't go through it alone. I will be with you every step of the way. I will teach you how to identify and distance yourself from your hardwired symptoms of suffering so you can learn how to think, feel, and act as your authentic self. You will learn how to and practice determining and asserting your true thoughts and feelings, setting appropriate boundaries with people and situations, pulling yourself out of past and future tripping back to the moment, rationally responding to interpersonal challenges instead of reacting, and emotionally validating yourself without the need for external reassurance. And that is just the tip of the iceberg. Eventually, your agency and confidence will bloom, even if the people in your surrounding system refuse to make all the necessary healing changes we point out to them. I can't wait to begin guiding you on your healing journey. See you soon. Best wishes, Sonia.
Thank you so much, Sonia. Oh my gosh. I mean, I was smiling all the way through because I just how refreshing it is just to feel the truth and to hear the truth laid out in front of you. I wonder, as you were reading it through again, like what is standing out to you as you revisit this piece?
Absolutely. You know, it it's so interesting when teenagers, well, any age patient comes into the office, there's this expectation that I think society or maybe the medical establishment sort of has floating around that you come in, you get a diagnosis, you get a pill, and then you leave and you sort of have this diagnosis for life. But that is, it just reminds me how disempowering that is to label someone with something completely erases the context, and the context is everything. And I think the biggest thing I try to instill in my patients that I'm remembering as I read this is these symptoms are normal responses to what is happening. It's not an illness. And that's really hard for people to wrap their head around because you grow up, we all kind of grow up in this society where at least mental health is finally getting, some props and being taken seriously. But there still needs to be a major shift that happens in that. So that's kind of what I'm thinking about as I read
Yes.
this.
Yeah, well, there's a number of layers as I read your piece and also think about this collection. We want this to be pieces that are written for youth, that's empowering for them, that's acknowledging their capacity to make decisions and to be spoken to really authentically and truthfully. And I think this piece does that. Like, let me tell you what to expect. Let me tell you what's going on, coming from an authority in psychiatry and a doctor, there's like you're speaking from such experience. And then the other part is looking at this as a mentor text for writing and, using the letter format as a way of communicating and speaking, and this repetition of like, let that sink in. I'm going to drop some knowledge on you, let that sink in. And there's that repetition in there as well. So you're like infusing a lot of facts and information and also really taking care of the reader. And I think this is a great mentor text for what we do in, English language arts schools where they have informational essays and, how to weave in facts and authority and like rhetorical writing, all those kinds of things. But this is a really lovely way of looking at a letter and how the letter can speak directly to the reader, can take care of the reader, can infuse facts and information in a caring way. And I just wonder if you could talk a little bit about the process of writing this piece.
Absolutely. And going along with what you just said, what is coming to mind real quick to segue into what you asked, in talking, like, so if I was to read this letter to a teenage, and I say these kinds of things to my teen patients, but I'm talking to them as if they are an equal partner and like a collaborator in this because their brains are forming, right? And they are vulnerable to tying into because their identities and their brains are growing. So their identity formation is happening biologically. And so to drop a diagnosis on them, there is a risk that that can be tied into their identity. And that is dangerous because then they latch onto the sick role. And so I think to talk to them like using this letter format, it's very much like, and the repetition, very much speaking to them as if we're like equal partners in this journey. And this is something that you're going to be responsible for your own healing, right? That it's not me, the doctor, coming in and like saying, this is what you have. So that it reminded me of that when you said that. And in terms of the process of writing this, it was great because really paring it down to under 1,000 words was really a wonderful challenge because, I think my original was like, I mean, I could pages and pages, right? But trimming it down, what I do is I write like, let's say 10 pages, just let it all pour out and then really go back and write and rewrite and cut and slash. And the process takes about a few weeks of just slashing things out, refining the way I've written. And in terms of the repetition, I love that you noticed that like from the jump. That I think is really helpful to teens because it's very overwhelming when they're coming in and oftentimes not even wanting to be there. So
Yes. Well, and I think
I answer your question. Sorry.
yes, you did. Like, I think in the writing process of it and thinking about your audience, which I think is the other like key thing where we, as writing teachers, sometimes we can, in school settings, particularly, we can get lost on thinking about an audience and taking care of the audience or respecting the audience, the person that we're addressing our writing to. Sometimes we just think it's the teacher or whatever for a grade or some test or something. And I think taking care of the reader is an important thing, and what you believe about your reader is an important part as a writer. And I would say, just because I read all of your books, that you trust your reader.
Mm.
Like you believe that you can say what you believe, that they're ready to hear this, that they can handle what they're going to hear, that you're going to take them through it, that there's going to be moments of fun, moments of laughter, moments that are hard to hear and are uncomfortable, but just enough that you can sit through it and come out the other side of it, you know. And I think when we're talking about youth or even just, you know, adult readers, that we can handle things, and we don't need to sugarcoat it all the time. We can speak authentically about it because we're talking about real lives and real people. Um, I think you do that so well in your writing. Um, and you do that well here. And I think we want to train our students to, or support our students in doing that too. When they are on social media, that they think about the audience and
Mhm.
who's reading it and their responsibility to whoever follows them, and in school with their writing, and that their responsibility to whoever reads what they're going to write, and to take care of that as well. So yeah, I think that's just, I just want to compliment you. I guess, you know, you don't need me to say that because you.
No, thank you so much. And I just thought of something when you're saying that. That is so spot on, because if I translate that to my work, it's basically the idea of acknowledgement and validation of experience. That's exactly what I was thinking about when you were speaking, because that is the thing that allows healing. So speaking the truth in that capacity is absolutely the thing that allows someone to begin that journey of healing, not sugarcoating, not like that. And that's science. So our fields are related.
Yes. Yeah, well, we do want healing, and I think we do see how writing can invite a witness to our experiences and our healing as well, which is really great. Well, I wonder if you could say a little bit about what you're working on now, or what you're celebrating now, and what you're working toward next.
Yes. Uh, my other baby, Geeta Desai's Not Here to Shut Up, just came out into the world in September. Very excited. Um, I would say that, like Ronnie, Geeta, well, Ronnie was based on my high school experiences, and this is my college experiences, but also in both of those books, weaving in things I've worked with other young people, their experiences. That's why it's fiction. So I have more liberty to sort of tie all these things in and try to make it more relatable to different people, not just like other me's out there, if they're, but yeah. And I'm really excited about it. I think it's quite, I really try to steer away from the whole issue of diagnoses. It's not about that. And it's not about just, I don't want to give too much away, but it's not just about trauma. That word is thrown around so much. It's actually about what happens inside Geeta's mind and body, and how the fallout of stuff she's been through in the past. And it's super realistic. And if I had read this before college, my life would have been 180. I would have like, it would have changed so much. I think saved me a lot of heartache for like 3 decades to come. But that's okay. Now it's out there, and maybe it'll help someone else.
Yes.
And,
Wait, I'm
you
going to say
know,
one thing about that before you go to the next one. Yes, so much of that book resonated with my college experiences as well. So I think people who were in college in the 90s-ish kind of thing, um, without knowing what to expect or what it was going to be like. You know, I was just confronted with all of these experiences that I had no frame of reference for, and people bringing me to these different places, and I did not know what to expect. I didn't know what things were happening in my body or to my body by these people, all of those things. It was very powerful and moving. I see this as like a upper young adult, you know, even just people who were in college in the 90s would really appreciate this book, as it's really, it does help us make sense of what was happening at that time
mm,
in a really powerful way. It was, yeah,
thank you.
this
Thank you for
rocked my world. This book was, I had to take a few breaks reading it.
Uh,
But it was, yes, I mean, it spoke truth. Yeah.
thank you. Thank you, Sarah. Yeah. And then the second part of your question, I'm trying to work on a novel in verse right now because, and this is sort of thinking about some of my teen patients and my son, people who don't necessarily love to read. Um, you know, I'm trying to pack some power in some short words. So I think writing this short letter was a wonderful way for me to sort of begin that journey. So that's where I'm at right now.
Fantastic. Well, yes, I can speak from experience teaching many people who are finding their way with reading and really glad to see that their books come in many different forms
Mhm.
and devoured verse novel after verse novel after verse novel and inspired me to write one myself and just to really think about how the power in a collection of poems telling that story, the narrative arc. So I cannot wait to see what you do with it. I'm so excited.
Thank you. Thank you so much.
So great. Well, as we close, is there anything you'd like to say to the teachers and the young youth readers before we close?
Um, I think if in terms of encouraging readers, let's say with the essay and every other piece in just YA, it's so powerful to have them kind of read and then connect with their own experiences. So if that, I don't know if that can be brought up in teaching, but don't be afraid to talk about mental health stuff because talking about cutting or suicidal thoughts isn't going to make someone do that.
Mhm.
So I would encourage just to talk about it and ask, even if it's in private after, but don't not talk about it.
Okay. Yeah,
Yeah.
thank you for that message. We're going to hold on to that. And thanks for joining us today, Sonia.
Thank you, Sarah. Happy holidays.